In this video, I will tell you the benefits of almonds for diabetic patients. Almonds can be beneficial for diabetic patients for several reasons. 1. Low glycemic index. Almonds have a low glycemic index, GI, which means they cause a slower and lower rise in blood sugar levels compared to high GI foods. This helps in managing blood sugar levels more effectively. 2. Rich in healthy fats. Almonds are high in monounsaturated fats, which can help improve insulin sensitivity. Consuming foods rich in healthy fats can also aid in managing blood sugar levels. 3. High in fiber. Almonds are a good source of dietary fiber, both soluble and insoluble. Fiber slows down the absorption of sugar into the bloodstream, which can help prevent spikes in blood sugar levels after meals. 4. Nutrient dense. Almonds are packed with essential nutrients such as vitamin E, magnesium, and antioxidants, which benefit overall health. Vitamin E, in particular, has been linked to improved insulin sensitivity. 5. Weight management. Including almonds in the diet can help in weight management, which is crucial for managing diabetes. Their healthy fats, protein, and fiber combination can help increase satiety and reduce overall calorie intake. 6. Heart health. Almonds are heart-healthy nuts. Diabetic patients are at a higher risk of cardiovascular disease, and incorporating almonds into their diet can help reduce this risk due to their beneficial effects on cholesterol levels and blood pressure. 7. Blood pressure regulation. Almonds are naturally low in sodium and high in potassium, which can help regulate blood pressure, another important aspect of diabetic management. However, it's essential to keep portion sizes in mind as almonds are calorie dense. While they offer numerous benefits, excessive consumption can lead to weight gain. Consulting a healthcare provider or a dietitian for personalized dietary recommendations is advisable for diabetic patients.